The center's been doing this work for about 3 decades, and we've been doing it actually a little more than that, but as the center as a nonprofit, we've been around 28 years. We're located in the San Francisco Bay Area, but we have people all over the country my philosophy about building the center staff is to create a organization that has the most passionate, the most resourceful people who play well in the sandbox with others. And so half of us are here in the Bay Area and half of us are located all throughout the country. And our mission's simple and it hasn't really changed over the years. It's to advance best practices and empower healthcare leaders with quality research that demonstrates the value of design to improve health outcomes, patient experience of care, and staff satisfaction and performance. And how we do that is through these 3 pillars of research, education, and advocacy, and each one feeds the next. So for more than 30 years, we've been creating and collecting and organizing and sharing the largest compendium of industry-changing research, best practices, and resources and tools. So for us, it all starts with research. That's really the underpinning of our work, and our connections with industry leaders and our relationships with foundations has really helped us to create resources that help to identify the impact that investing in facility design can really make. And I'll go into more detail some of these as we talk about some of the resources later on in the presentation. So after we learn something through research, it makes sense next to get it out. So we really focus a lot of our time and energy on education to help spread knowledge. And our education is everything from virtual to regional to national events. And the goal is really just to bring people together to share, to learn, to advance best practices all around healthcare design. And we also like to help equip industry professionals with the tools and the training that they need that enables them to effectively evaluate, test, prioritize, implement, and optimize their facility investments. So we also have, I think many of you hopefully have heard about EDAC. We have an internationally recognized certification program or evidence-based design accreditation and certification program, which awards certification to anyone in our industry, from manufacturers to architects to designers to healthcare professionals, all who demonstrate this understanding of applying evidence-based design process to healthcare facility design. And then finally, after we've learned something and we've taught something, we try to codify and we try to make things become that new minimum level, that new standard. And so we move it into advocacy, and that's where we celebrate and codify our positive change that we've been able to see that design can make. So to do that, we focus on a whole variety of initiatives that promote an understanding of and the strategic application of design influencing healthcare performance, patient satisfaction, and staff productivity and safety. That includes our Built Environment Network, which is a group of senior level healthcare facility executives that are responsible for millions of square footage of healthcare facilities. They meet 3 times a year. We have a whole variety of design competitions to celebrate greatness. One is the Healthcare Environment Award. I mentioned it a little earlier before we started. It actually has a student category. So if you have a great project that you've done, I encourage you to submit that and get it hopefully published in the magazine and up at our conference. We have our Touchstone Awards, which is about celebrating the use of the EBD process, and our Nightingale Awards that are geared towards product design. We have affiliate membership and our Environmental Standards Council, which works to work with the Facilities Guidelines Institute every 4 years during the cycle of recreating the guidelines for minimum standards. And then this is just a chart we did around our 25th anniversary, which helped to show the research work that the Center has done or funded over the years, and how it connects to main things that were happening, like the Institute of Medicine's quality report or to Err is Human, and how the center's work has really responded to what was happening in the industry. And so you can see we've been very busy. And this is just the research work that we've done. And one of the nice things about a lot of people coming to visit us and our work being so much online is that we've been able to really trace our impact. And you could see from all the places in red that really we've been able to have global reach, that people from all around the world come to our website on a regular basis to use our tools and resources, to ask questions, to learn from one another, or come to our workshops or our conferences. So, we are very much about building a community, and we've been grateful to be able to do that globally. So I talked a little bit about EDAC and evidence-based design. That really is the underpinning of so much of the work that we do. And so one of the things I'd like to do is encourage you guys to think about becoming EDAC certified before you graduate. It's one of the key programs of the center, and it's a great thing to take out into the world. And what EDAC does is it really looks at your ability to understand that evidence-based design process and then apply it to the work that you do. A few years ago, we also launched an award called the Touchstone Award, which is about celebrating projects that have actually used the evidence-based design process and measured their results and got them out into the world. And so we now are both an accreditation and a certification. And here's just an image of that evidence-based design process. It's something we created many years ago through a consensus process that was that brought together a whole variety of people from all throughout our industry to really define what is an evidence-based design process and how does one go about using it. And a shout out to Kirk Hamilton, who is part of your faculty there, who really was a big part and a driving force behind this consensus process. So next, I want to just talk a little bit about the continuum of care in light of the different factors that we're seeing are influencing how that's changing, and how our industry is changing, and things that we're looking into both doing more education and research around. So the first influencer I want to talk about is telemedicine. So when I was doing the research to put together this presentation, I came across this chart that SG2 created in 2015. And what I thought was really interesting to note was they looked at what they thought the projection might be in 2021 of how many visits we would see through telemedicine. And what's interesting is they thought we would be somewhere around 93 million by 2021. And then came COVID, and that accelerated that trend beyond anything we could have ever foreseen and led to over 1 billion telemedicine visits in 2020. And so now we're seeing that number drop significantly as people are able to go back and visit their doctors. But without a doubt, telemed is here to stay, and it's going to have a very significant impact in our work and in the continuum of where care happens. The second influencer is the issue around medical technology. And medical technology touches all the settings where care is provided, from a person's home to a hospital to long-term care environments. And soon all healthcare settings we're hoping will be connected through technology. And the hope is that it will help to facilitate a more seamless transition between these different environments and facilitate more prompt patient-centered care. This figure that I pulled from one of our presentations that was done around behavioral health really defines the different settings that are a part of the patient's journey that could be a part of the continuum of care. And for some, it's very linear, but for others, they jump around throughout the different kinds of environments, and it's not so much a linear process. So an example is that in clinics, technology advancements are really getting smaller and more affordable. And in the home, technology is allowing more acute care to happen in the home and for people to stay out of facilities altogether. In long-term care, technology is really improving the safety of the residents who live there. The next influencer we're seeing a lot is the trend towards wellness and care everywhere. We're rapidly moving to a culture of health where health and care is everywhere, which is really breaking down the walls of what we've seen traditionally defined as healthcare environments. For decades, our paradigm was to build this big box of patient rooms, academic and acute care hospitals that treated the sick. Wellness was signing up for your healthcare gym membership, which probably nobody ever used. But today we're really shifting left, and we're seeing fewer acute care facilities being built, and healthcare is becoming more decentralized. Ambulatory surgery centers and urgent care centers are everywhere, and we're seeing more freestanding emergency departments and behavioral health facilities. Primary care is now even being delivered in healthcare settings like your local grocery store or big box store. Related to this is the issue of healthy communities. Where we live shouldn't determine how long or how well we live. And in our communities, we should all be surrounded by the conditions that enable us to live the healthiest life possible, such as access to healthy food, quality schools, stable housing, good jobs with fair pay, and safe places to exercise and play. And unfortunately, in many communities, there's a persistent barriers to health and opportunities for them to really thrive. How our communities are planned and designed and built can have a major influence on our health. And we need to really change how we're building and designing our communities in a way that makes it easier for people to get and to stay healthy. And I think that we're well on the road to looking at that. The next big influencer that's impacting the work of the center is what we have heard of as either the gray tsunami or the silver tsunami. And we're spending a lot of time exploring that in our work. In the past, life expectancy has been much shorter, and our focus has been much more on the immediate solutions for the deterioration of our mental and physical ability. Now, many of the diseases like cancer and heart disease that used to kill people have become manageable and chronic conditions that can be treated even in the home. With the advancements in medicine, we're living longer and we're learning that design can actually assist older populations and benefit all. And as I mentioned earlier, technology has helped to decentralize care and helped us to consider how to extend a higher quality of life for our senior populations. We're seeing more and more innovative models of new ways and new places that seniors can opt into in order to where they want to live, from universities to naturally occurring retirement communities where people help one another. And the universal design approach is being fostered among many forward-thinking groups to see the benefits of equitable, flexible, and accessible design for society as a whole, both today and into the future. Design strategies include environments that support aging in place, social networking, active living, age-friendly workplaces, and person-centered healthcare. When designing for aging, there are really great opportunities at hand to design for all of us as we age to live a healthier and better quality life. Village communities are bringing different generations together to help aging people remain in their homes instead of moving into old age ghettos as we have in the past. Aging people are able to receive assistance similar to what they would receive in a retirement community, but without ever having to move from their own homes. Younger generations are benefiting from building relationships with older members in their community and considering how these kinds of models can help them as they age in their later life needs. And there's an increased focus on independent living. How are we designing to effectively age in place? How do we design to allow chronic care to be delivered in the home? And how do we look at a host of issues that really impact the ability for people to stay in their own homes, like lighting, landscaping, doors, pathways, the electrical requirements, patient handling and movement. And this is an image I'll get to a little bit later, but it's one of our tools that we just put up on the site recently that calls out the different elements that one might want to look at if they want to design a home to age in place. The last influencer that the center is focusing a lot of time on these days is around behavioral and mental health. In the United States, behavioral and mental health conditions affect 1 in 5 adults each year, and that's even more common among patients that are receiving care for various medical conditions, especially chronic conditions. Traditionally, there's been a focus on safety and preventing industry, especially self-harm. This has led to some really institutional settings that are designed to address the safety concerns, but with little or no concern for patient privacy, personal control of the environment, etc. The facility guidelines originally included a section about assessing the risk, and it was in the psychiatric environments. But that's really moved in recent years as we've come to realize that and have a better understanding that patients are at risk for self-harm all throughout healthcare settings, not just in psychiatric settings anymore. Our understanding of the broad range of conditions and the need for a balanced approach is suited to patient populations has expanded our thinking. Care for behavioral mental health patients isn't a one size fits all anymore. Designing safe and therapeutic environments that promote psychological wellness and healing are both important for all patients, but especially for patients with behavioral mental health concerns. One example is incorporating nature into design, which can soothe, comfort, and calm and orient, something that's beneficial to all healthcare settings, but especially in environments that specialize in behavioral health. So, unfortunately, COVID-19 has sadly really exacerbated issues around behavioral and mental health, especially due to this increase in isolation that so many people are feeling at all demographics. Here are some statistics that we pulled from one of our recent, again, workshops in behavioral health that are just really stunning. 67% of people reported higher levels of stress during COVID. 57% reported higher levels of anxiety. 53% reported greater levels of sadness, and 42% reported that their overall mental health has declined over this last year. I mean, these numbers are significant and need to be explored in terms of how the built environment can either contribute to making this worse, contribute to isolation, or help to break down these barriers and provide comfort and some level of help as we find people more isolated moving forward in the pandemic. So finally, in this last section, I want to spend a little bit of time talking about the tools and resources that the center has created over the last couple of decades that are available to you. And as I said, as Affiliate Plus members, those of you who are students at Texas A&M, all of this is available for you free of charge. So I encourage you to explore them and see how they might be able to help you in your work. So the first is our interactive design diagrams. And these are a set of, as I said, interactive diagrams that provide links between the evidence-based design strategies and desired outcomes in a visually intuitive and actionable format. Thanks to a grant from the Dangia Foundation, we add to this tool every year multiple different spaces and rooms. And you'll find settings in every phase of our work, from acute care, clinic care, ambulatory care, behavioral health, and recently we've been focusing on the home health environment. So this is one of our most utilized tools on our site. It's easy to use, it's intuitive, and it's layered with so much useful strategies and resources to back up all the strategies. It's useful in the research you're doing, as well as helpful to help communicate to clients the role that design plays in contributing to quality outcomes. And each one of those white dots you see is an interactive design strategy, and then the research that underpins why that strategy is of value. The next resource I would love to share more about is our knowledge repository. And again, this is a grant that was a grant funded project through the Robert Wood Johnson Foundation. It's another, probably the most heavily used resource on our site. It's a complete searchable database of all the journal articles we've been able to find that relate back to the work that we do in designing for healthcare. We currently have about 5,200 citations in the repository. We add more every month. Our research team, in the work that they do, as well as by doing searches of the research on a monthly basis, are constantly adding new resources. And if you sign up for our research in the SNAP emails, you'll get the monthly updates of the new studies that have been added. Within the knowledge repository, we've also created something called key point summaries, and we have just under 900 of those right now, where our research team has gone and found the journal article, read through it, and talk about the different findings and the salient points from the study, including the limitations and the methodology. And so again, we're adding about 100 of these each year. And for people who don't have access to the journal, don't maybe understand deeply how to read and interpret research, or just don't have time, it's a great shortcut to finding the research. And then from there, knowing which studies you might want to go and find the journal articles to learn more about, to read in full. And we've added constantly new features to the knowledge repository, two of which we added this year, the SlideCasts and the leads. So SlideCasts are an outgrowth of our presentations every year called Research Matters at the Healthcare Design Expo and Conference. Our research team selects the papers that they feel have the most significance this year, and then they do a deep dive into distilling what that study means into a 5-minute summary and how the study was done. It also talks about the limitations and the takeaways, and the slide casts help bring the research to you quickly and in an easily digestible format. They're graphic and they're interesting, and they're just quick 5-minute snapshots. In journalism, a lead is an introduction to an article that makes you want to read more. And so we've created leads within the knowledge repository that are 35 or 40 word features that give you the 5 W's of who, what, when, where, why, followed by a little nutshell paragraph that basically sums up the research in a nutshell. They're 2-minute videos, and they just give you a quick synopsis of information. So both of these are ways to quickly gather a lot of content and information and bring it to the work that you're doing. So also as part of our Affiliate Plus program, we created a whole slew of topic toolboxes, and you could see they're in everywhere from noise to infection control to patient-centered medical home, ED throughput, behavioral mental health. These are available to everyone, but certain content's only available to Affiliate Plus members. We add new toolboxes and new topics each year, and we add new resources to each toolbox each year. And here are the kinds of resources that we have in each toolbox. So you can see it's everything from a deep dive issue brief to an executive summary. We have blogs that are featuring things that are happening in our industry, other industry resources from outside of the center, infographics to help communicate content quickly, project briefs that highlight projects that have been done well in that area, webinars on a whole variety of topics within that topic toolbox, lessons learned for a quick hit of what might make sense to look at, design strategies, and then each of the toolbox has a different assessment or planning tool that's a part of it. So highly recommend spending some time doing a deep dive into the different toolboxes. And as I said, again, all of this for you is free, even the things that would normally be behind the paywall. And through Kresge, we funded a tool a few years ago that really focuses on population health strategies and how to create healthier communities. And it's organized around 4 different main goals of population health: healthy behavior, the physical environment, social and economic factors, and clinical care, and 5 main spatial components within each of those, from building exteriors to the interiors to the waiting and check-in process, patient clinic interactions, and staff space. And this is an interactive tool that allows you to fill in each of the different areas and save it for future use. We also have a huge library of webinars that we've been building over the decades. There are currently 165 available on demand, and that number grows every month. It's topics from behavioral health to safety, impacting aging, pediatrics, technology, evidence-based design, as well as early on, we really focused on capturing the voices and the thoughts of some of the icons in our industry. So you'll have access to listening to people who aren't even practicing anymore, but were a part of really helping to build the cornerstones and the basis for our industry early on. Next, I want to share a little bit about our HERD journal. So over a decade ago, one of our board members happened to mention that you're not really a field until you have a peer-reviewed journal. And so we went about creating a peer-reviewed journal. Today, HERD is an international, interprofessional, peer-reviewed journal that features research and methodology papers theory articles, case studies, and book reviews focused on the effects of the healthcare environment and the design on patient outcomes. Kirk Hamilton, our very own Kirk Hamilton, is one of the founding co-editors and still co-editor today. And Hao Huang is the person who keeps Kirk in line and makes sure that everything happens the way it's supposed to happen. So your university is a big part of this journal and has been from its infancy. The second thing I just want to note about this journal is the impact factor that you can see. So the impact factor talks about how often the articles in the journal are cited. And for a journal our size, to have an impact factor of 2.1 is significant, and that has grown every year. So kudos to all of the people who work on the journal, but also to our industry for creating such an impact so quickly. Another big piece of what the center does is workshops. So, many of you are familiar with the large conferences that we're involved in, but really the center has been trying for many years to create more intimate learning opportunities that help people to not just learn, but to build a community and build their own community as they're building knowledge. And so every year we run a variety of workshops. Some are free, some are pay. Some are larger, 700-800 people, but many are smaller and include intimate breakouts. So COVID has really forced us to think about how we can still create that sense of community and that intimacy in a smaller setting. And we've been really successful. So if you're interested in any of these topics, pediatrics, behavioral health, aging, or EDAC, I highly recommend you check out the workshops. That they're a great way to not just learn a lot, but have an opportunity to meet some people from across the country that you might never be able to. And I think the thing that we've learned this year is that there's some real value in doing virtual workshops, something that we only launched because of COVID, but I know that we're going to continue to do that. We have people who came from all around the world to be a part of these workshops that would never have been able to get on a plane and be a part of them. So moving forward, the center is really focusing a lot of our energy on virtual learning and creating these social and educational experiences. And I think that you'll see us doing more and more of these, making them more and more available to more people. And as I mentioned before, EDAC is something that I really strongly encourage you to look into and to think about becoming EDAC certified before you graduate. It's a great thing to have under your belt, but we also offer just huge and significant discounts for students. And we have a wide variety of study tools that are available. We have study cards that you can download from the internet. We have videos that we've created, the flashcards, there's study guides, we have workshops. So there's lots of ways that we help you to get through the process and become EDAC certified. So again, if there's a way that we can do something at your university level, we're happy to. We really would love to see as many people graduate with having this under their belt before they get into the industry. Another tool that we've created is the safety risk assessment tool. And the safety risk assessment tool looks at 6 different key areas of safety: infection, falls, medication errors, security, injuries around behavioral health, and patient handling. The goal of the toolkit is to assist the design of the built environment that supports workflow procedures and capacity while ensuring safety at the patient and the staff level. It's designed to be used at the start of the project before pen has even been put to paper, and to help people have relevant conversations with all the different key stakeholders that need to be involved in order to mitigate risk. So it's a live, fluid toolkit that, again, you create for each project and are able to save your content and your information and work on over time. So again, free to everyone, and it's a very well used tool on our site. So worth looking at even for the projects you're doing now. And then next is a new tool that we have coming out this year, and it's around the functional program. It's come from our Environmental Standards Council, which is a group of volunteers that meets throughout the year, specifically to work on the facility guidelines. But from the guidelines, they started doing a lot of work around the functional program tool that is required by the FGI as part of the guidelines, and to create this step-by-step process that is designed to, again, be used before design ever even starts, to have a variety of conversations to help fulfill that requirement of doing a functional program, so that in the end, the goals of the project are communicated from the client to the design professional. And then just in closing, 2 resources that are from the center, but are done in conjunction with our partners at Emerald Exposition. So the first is the Healthcare Design Magazine, which is published 10 times a year and features a whole variety of products and case studies and stories that are relevant today to the work that we're doing. So the center tends to kind of throw a pebble further out there and look at what will be relevant to us 5-10 years into the future, as well as what do we need today. But the magazine really features the current state of our industry and captures where we're at and what people are doing in the here and now. And the next are our large conferences, which we have not had this year, but we hope to, or we did not have last year, but we hope to have this year. The first is the Environments for Aging Conference. And Environments for Aging is really focused on what we talked about earlier, which is all of the different new types of environments and ways that people want to age in place, and how we can build better environments for aging, and the research that specifically goes into that field of study. It happens every year in the spring. This year, because of COVID, we pushed it, and we're going to hopefully have it at the end of August in Chattanooga. We have about 1,000 people that come to that program every year. And then there's healthcare design, which hopefully many of you have been to over the years. And this year, healthcare design is moving to October. It's going to be in Cleveland. And we usually have around 4,000 people, about 100 different presentations there. It's where we feature all of our awards. So for those of you who are hopefully going to enter in and win the Healthcare Environment Award, we'll be able to acknowledge and celebrate you at the awards banquet at conference this year. So, again, I can't press enough upon you that you are fortunate enough to have the Affiliate Plus membership. And, when you graduate, that's not something you'll have access to. So spend the time, look at the tools, look at the resources, create your own account. And in doing so, you can save all the resources as PDFs so that you have them for the future. And I'll offer that we are happy to do a presentation for you at the university level and record it, that you can have, that helps people to understand how to make the most use out of all the different tools and resources that are available. Also, there's a ton of networking that we have. We have different events throughout the year that you're invited to as part of the affiliate program, where you can meet people from all over the country who are doing similar work, students from all over the country who are doing similar work, and professionals who you might want to learn more about what they're up to. So look into all of those benefits. And then, follow us on Facebook and LinkedIn and Twitter and Instagram, and create a free account. And, as we create new tools and resources, this is how we push them out more and more. So hopefully you'll connect in with us, and even past graduation, you'll be able to stay connected to the center, because as you grow, we want to feature the things you do and really help you in your career past your years of being a student. So running about 10 minutes early, but I would love to open it up for any questions that you guys might have about the center or work, or how you might be able to be a part of it.
Well, I'd like to just thank you, Deborah. That was a refreshing presentation that was very important for students interested in health, because of the breadth and depth of your presentation. And I can't thank you enough. You've come at a very good time of the year, and we hope to see you back often. And I would like to say to the students and to you, for the first time, we have this now on the AIA Academy on Architecture for Health website, where they can click on it. You can go to and just click and come right into the Zoom without having to go through any other steps. And we have a few people. I just want to recognize Eric Baker is here, and he's uh, working with Larry Zuber in the College of Architecture Development Fund. Joe Sprague is online. I don't know if you can hear me.
Yes, I can hear you, George.
Okay, Joe, you may want to say a few words because it was your idea to invite Debra.
All your fault.
Oh, my fault. Well, yes, I'm embarrassed that I was unable to do the honors of introducing Debra, and through technical difficulties was not able to get on. But I just want everyone to know that Debra has been I would say, a professional colleague for many years in the field, and her leadership is widely known and respected. I particularly encourage the EDAC certification. I think that is certainly an opportunity that gives you credentials and opens doors potentially with other colleagues and potential clients. And having been part of the leadership of Facility Guidelines Institute for many years, and have some relationship with some of her other staff, very strongly supporting of their work and functional programming. So as an affiliate member, before you get out and start working hard in your postgraduate and or professional work, please take advantage of her very kind and generous offer to become an affiliate member and take advantage of a lot of these things she's been mentioning, because believe you me, if you go back in your career, you'll point to this as an opportunity that you were so thankfully given, and that you took an opportunity of. So thank you, Debra, and I appreciate you coming. And I know you have a very busy schedule, and to have some time for the students and the university folks and others is highly appreciated.
No, as I said, it's my pleasure. And, I have an open door policy that, if any of you ever have a question, or don't hesitate to send me an email or reach out. I'm happy to talk to you and help in any way that, we all started somewhere. And, I know that my life was definitely impacted by the people who either made a connection or pushed me in a direction that made all the difference in the world for me. So I'm happy to be available to any of you as you kind of follow along your career to make those connections, or, just lend an ear if there's something I can help with. And again, the center is happy to work with you guys at the university level in any way we can. If you feel as though you'd love to do some EDAC workshop classes, we'll figure that out for you. If you want to have a webinar on what it means to be an Affiliate Plus member, we'll work that out for you. So, our goal in the industry is just to support in any way we can. So please don't think twice about stopping me if you see me at conference, or reaching out through email or phone. I'm happy to talk to you, especially now that I'm not traveling. It's very easy to find me. So.
Well, that is very good. And I want to point something out to everyone, that you have a gift for giving talks. You didn't stumble once. The words flowed and flew. And also they were augmented by excellent graphics. Sometimes on Zoom, people do things too small that they can't see. And that was not the case in this presentation. So
and George, I want to add that, Debra has been a big supporter, for the healthcare design, not only in the United States, but around the world. She's the big supporter for the China initiatives at the Center for Health System and Design. And she provided presentations to the Chinese each time she hosted the healthcare design conference. And so that's a big contribution to the world. Debra, I want to compliment that. Yeah.
Thank you.
And we have a visitor, Josiane Tanchou from France. And welcome. We hope you come back often. I know you want to spend some time with us at Texas A&M. So anybody else have any comments and suggestions? Please go ahead.
This is Ron. I'd just like to add to the compliments to Debra and give her a big thank you. You students don't at this point realize what treasure you just got from her. There's been the discussion about evidence-based design. This is where it all started with this center, in architecture at least. But I want to say beyond that, and you saw it in her slides here, they put a strong emphasis on what I'm going to call quality design, evidence-based design that has quality to it, that has healing environments and those things, and they have a great design award program. So this is an organization you need to become a part of after you graduate, if you're in healthcare particularly. Thank you, Debra, for a great presentation.
Thank you, Ron. Thank you. Thank you. Like I said, I wish for all of you a career as awesome as I've been able to find, right? To be able to every day wake up and be challenged by and love what you do and get to do it with, you know, our industry for whatever reason. And I think it's because a lot of people go into healthcare design for personal reasons, but our industry pulls some of the most heartfelt, amazing human beings into it. And I mean, I've created lifelong friendships with people who started out as colleagues and are now our family. You know, you have picked the right place to spend your time and energy if you pick healthcare. It's truly an amazing place. And it is, as Zipeng said, it's global, right? We're doing work all over the world. And because it's all the same, right? It doesn't matter where you're born, the issues and the concerns are all the same.
Any other questions from the students or comments? We'd love to hear from you.
Oh, so sorry.
Go ahead.
No. It's all you.
Oh, so I'm not really like an architecture kind of person. I'm more of like almost gonna be a medical student. But I have a question in terms of like kind of like in the field of like geriatrics. So I know you were mentioning how like we're trying to like the seniors now that are aging are starting to go like more like what they can do at home. So do you think there's going to be like an even bigger decrease in like nursing home occupancy? I know like with COVID now, it's like their numbers have like gone down like almost half. So do you think that trend is going to like continue?
Yeah, I think there is. And I'll say it's for a couple of reasons. One, technology is enabling people to stay home, right? So nobody wakes up and says, I want to live in skilled nursing, right? There are benefits to congregate care in that you're not alone, but many people really want to stay in their home and stay in their communities. And so that's one. Two, people are aging healthier, right? That they're not, my mom and dad, I just lost my last parent. My parents stayed in their house until their late 80s and early 90s, and it was fine. We brought in care when they needed it, but people are healthier longer and able to stay in their home. The third is that the whole system, we knew it was broken, but COVID just shined a spotlight on how broken it really was. The isolation that so many people found, the dramatic aging that many people experienced because of the isolation in these facilities, it's not sustainable. It's not even okay. And so I think that there's an entire rethinking of that whole industry to understand how can we do better. And I think we will. I think we will see a dramatic set of new kinds of smaller environments. And the key is how to do it in such a way that it's affordable to all, because a lot of places are really only affordable to those who have resources, but the majority of Americans don't. And so what we need to do is to continue to have these conversations around how do we create quality of life opportunities and options at every socioeconomic level.
Well, you've had quite an audience here today. And as I say, we're trying to broaden out the base, make it easier for people around the country and around the world to access the lecture series. It helps the students, it helps the speakers, and it helps the general public, which is what we're all about. And if you have a last question, do it now. But I do have just a couple of short announcements to make about the next lecture. Anyone?
Debra, I'll add my kudos to your presentation and to the work of the center and to you as a person. The people on the call don't know, but we go back decades and it's wonderful and just love you to death. The work that you do is so important And
Thank
thank you for making time to be here today. It was terrific. And I will reinforce what Debra has said during her talk. We are affiliate members, and if you're interested, you got one testimony from Danielle. Yay. But we do make those resources available. If you're interested, talk to Shimei. She is the gatekeeper for the affiliate relationship, and she is responsible for the ways that we share it with people and use it to help people. So if you're interested in a topic, interested in more research or about a certain direction you're thinking of taking, maybe for a final study, get with Shimei, and the resources of the affiliate membership are yours to tap. So thank you, Debra, for making things available to us. You're doing great work.
Thank you. And I just put my contact information in case any of you need to find me.
Okay, because there are some things in the chat. I would ask that if you want to have some more dialogue with Debra, you see the contact information